Hi everyone, I'm Michelle again from Allegany County Department of Health, and today I am here with Connor, who is from Jones Memorial Hospital. Thank you for coming.
Oh, thank you for having me.
Absolutely. So can you introduce yourself and tell everyone kind of what you do?
Yeah, certainly. So I am the infection preventionist for Jones Memorial Hospital. Basically what that means is that I help reduce the possibility of you, when you come into the hospital, getting a hospital-acquired infection. And so what I also do is, because it's a team effect that we have, is that I provide education to our staff on things that they can do to reduce the chances of spreading infection, basically giving them the skills and knowledge so that we're providing a safe environment for all the people who come into Jones, not only just the inpatients, the visitors, our employees as well.
So you take care of everyone. That's great.
Yeah,
hey.
Exactly.
So today we're going to be answering some of the questions that we've received here at the health department. So a lot of the questions are in regards to quarantine, testing, medications, and then Connor's got a little bit of stuff that he would like to share. So the first part, we're going to talk about the quarantines. So yeah, I had also seen on Facebook where people are asking, have the people who have symptoms and known to be in contact with somebody who has this virus, are they quarantined? Yeah, all of that's been handled, so you don't have to worry about that. Again, let's say that you're in isolation or in quarantine and you want to know when it will be over. You will be actually given paperwork from the Department of Health that says, hey, go be free. So expect that. There's some questions about, let's say I'm mandated to quarantine. What types of activities am I allowed to do? Can I go outside? Can I drive? So that's a really great question. So we talked about that, and we're going to say it's okay to go into your yard. Okay, let's say you've got kids, you want to take them out to the swing set out back. Okay, just try to keep your distance. When it comes to driving, we think it's a little bit too risky for that. So we're going to say don't go for a drive, of course, unless it's an emergency and you've been mandated to. We understand that. But some really fun things are coming out for people to do online. There's a ton of new services. I see what they're doing, like the virtual museums
you can actually
and stuff.
take tours.
Yeah, zoos.
And don't forget, there's Netflix. There's Hulu. There's all those things, and best time to binge is now.
You can read books.
Exactly. Oh, there's that too.
Oh, crazy. So yeah, make use of your time. Have some fun though. Number 3, I'm mandated to quarantine or isolate and I'm not feeling well. Can I visit the doctor's office? Still, please give them a call first. They're probably going to ask what your signs and symptoms are, seeing if it's, COVID-19 related or maybe it's something else. And they'll give you a directive. They'll tell you what they want you to do. And if you need to contact 911, well, of course, contact 911.
Just give them a heads up that, hey, you're under quarantine or mandated isolation, just so that they can take those extra steps that when they arrive, they're able to protect themselves.
Yes, but you should always be able to feel like you can call 911 if you are having an emergency, for sure. So let's talk about people who are in self-quarantine. So those are the people who have not been told by the Department of Health that they need to stay away. They're just people who are taking their own precautions because they don't feel good. And awesome. They're doing a great job. And they're saying that their employer wants documentation. So here's the thing is it's self-quarantine, so unfortunately we're not going to be able to provide any paperwork. That's where you really need to talk with your employer, talk with HR, work with those internal policies from your job and find something.
Yeah. And employers should definitely be looking into their policies as well. It takes 2 people, to really make it work. So definitely I'd advise that.
Absolutely, thank you. And then we've got a question from the school district. So a lot of schools are providing like the food, which is really, really, really awesome. That's that was a really big concern that kids weren't going to get enough to eat. So they asked if they could ask who was quarantined. So please know they are not going to get that from us. We will never tell who's quarantined. We're not even advising them to ask. But if they do, remember, if you're a quarantine family, you are not mandated to tell anybody that you are under quarantine in that situation. What we're telling schools is, honestly, if they're dropping off, just to stay safe, just drop it off on the porch and, you know, walk away. Same thing if you got to drop something off at a neighbor or friend's house, you're doing something, picking up some toilet paper, just, you know, text them, hey, I just dropped it at your porch. You can wave from the car.
Yeah, go away.
You know, Connor, you had a good thing earlier. You were saying we don't want to call it social distancing.
Right. Yeah, because our mental health is very important when it comes to situations like this, and it can be stressful. So really, we don't want to say social distancing as much as physical, putting that barrier as much as possible between you and somebody else, just so that you don't spread this illness.
Yes, but be social. You know, FaceTime all your friends.
Exactly.
Another one is, you know, I need to reach the health department and no one is returning my calls. Please be patient. We're getting bombarded with phone calls, so they're taking messages. People are calling back when they can. You know, we have our phone number up here. It's at 585-268-9700. You can give that phone number a call if you have any questions, but again, just please be patient with us. Same thing, maybe send an email. I think one of the last ones is, I take medicines. Does this make me more susceptible to the COVID-19 virus? I've heard some stuff with like the ibuprofen. Really, there's nothing concrete. Our suggestion is please call your physician or your pharmacist. They're going to be the ones who know your medical record. They're going to know what medications are safe for you. Please go that route before you either start or stop any medications. And the final thing that we have is talking about testing. So remember what we talk about today. Things are updating constantly.
Like
We got a brief right in the middle of before we did this. So things are changing. Okay, this is how they are right now. Is that while it was on the Department of Health to do the testing, it has now been given to the providers or healthcare providers the option to do their own testing
using clinical judgment.
Yes. So again, we don't need you to call here. We need you to call your physician. Do you want to talk to them a little bit about the testing or how UofR is doing?
So testing will vary depending on where you're going to get tested. Mm-hmm. If your provider chooses to test you. And it's all going to be, like I said, based on your symptoms, based on the severity of your symptom as well. So what happens right now is there's a lot of, initially it was public health labs that had the capability to test only. So criteria was set. Then what happened was private labs started having this capability to test. So a lot of people started getting tested. The issue now is that there's a lot of backlog there. So turnaround time, from basically the time from collection to the time that we get results, has really increased, which is a problem, obviously. And so we're trying to prioritize those who have severe illness, maybe those who require hospitalization, to be the ones really getting the test, just because there's not so much around right now. So what we suggest is you always contact your provider. If you have questions, give them a ring, okay? If you don't have a provider, University of Rochester, one of our affiliate, actually does have a helpline that I have here, and it's also written up here, which is the UR Medicine COVID-19 support line. And the number here is 888-928-0011. And they'll be able to direct you as to whether you need to stay home, whether you need to go to an urgent care, emergency center, or you may require a hospitalization of some sort. They'll be able to direct you. And from there, we can figure out testing. And the other thing to keep in mind is testing is not done right there in the office. You have a swab, basically, that they put in your nose, and it's somewhat uncomfortable. If anybody's ever had a flu test before, very similar. Your eyes
not fun.
Nope, your eyes tend to water. But ultimately, that gets then sent to a lab, which then usually gets sent out to another place to get tested. And then hopefully you get some results soon. But again, like I mentioned, there's a lot of people getting tested right now. There's also a lot of shortage issues.
Yes.
So please bear with us, and we know that it's a difficult situation.
Mm-hmm. And I think really kind of one of the takeaway messages is, especially if you're experiencing like mild to moderate symptoms and you probably don't really need any interventions, that it really doesn't matter.
Correct.
I mean,
well, the thought is really if you have these very mild symptoms, which again, the understanding based on the current data is about 80% of cases will have mild to moderate symptoms, not requiring any type of supportive measures, oxygen or something else. So you wouldn't necessarily need a hospitalization. Those are the individuals that really should stay home until they feel better. Follow the directions of what your physician have given. If a health department has contacted you, follow the guidance that they have provided. Those are really your two main sources that you should rely on for that information.
Perfect. Well, I don't have anything else. Do you have anything else, Connor?
I don't.
Oh.
Although one little plug I have to do this, okay, is please follow us on Facebook, like us.
Yes.
You will get all the most updated information regarding Jones. So please follow us.
Yes. Well, thank you for being here with us. Of
Thank
course,
you for having me.
we'll be here again next week, or me with somebody. I don't know. Who knows? And thank you, and have a good weekend.
All right. See ya.